So those are the three main sites when you are treating jaw pain or TMJ pain. So the muscles we'll be focusing on for injecting trigger points into this particular area is the pterygoid. Next, I'm going to go into the temporalis muscle up here, and then I'm going to go into the upper third of the SCM muscle. All right, so when you're palpating this, there's the lower sulcus. Go ahead and open your mouth and keep your mouth open and you'll feel that sulcus. This is one of my favorite injections with TMJ, especially with a regenerative such as PRP. Trigger point injections into the jaw, TMJ, head, neck region. So with this, common pathologies include jaw pain, jaw locking, and TMJ. Frequently, the patients will report pain in the ear, outside the ear near the mastoid, as well as the temporalis region, the temporal region. So the muscles we'll be focusing on for injecting trigger points into this particular area is the pterygoid. There are two sulcuses. I always go on the lower sulcus. It's a little bit farther away from the facial nerve for most patients. Next, I'm going to go into the temporalis muscle up here, and then I'm going to go into the upper third of the SCM muscle. The other one I'll review is Splenius capitis. That is a muscle that is kind of right in the middle between the paraspinal and the SCM. And the Splenius capitis often will have a trigger point if the patient has multiple screens at work and they've got their head turned for long periods of time, approximately 10 to 15 degree head turn. So that's multiple screens, and they have their body in one direction and their head in another direction. So those are the 4 injections we are about to do. All right, so when you're palpating this, there's the lower sulcus. Go ahead and open your mouth and keep your mouth open and you'll feel that sulcus. It's right in front of the earring. Today I'm going to be using a 30 gauge 1/2 inch needle. 1, 2, 3, little pinch. Bevel is barely under the skin, inject and out. And on that pterygoid, it's no more than a 0.25 ml. This is one of my favorite injections. Go ahead and close your mouth. With TMJ, especially with a regenerative such as PRP. I've had very good success with patients with PRP, with the pterygoid, temporalis, and SCM near the insertion site, especially with the PRP or a regenerative product. So next we're going to be doing the temporalis muscle. This is like an egg-shaped muscle. The easiest way for me to explain this is if you take a visual marker and you cut the ear in half, stay on the posterior side of the ear because there is a great big nerve that goes into the shape of a Y on the anterior side. So I stay middle to posterior of the ear. And on this temporalis, I go just right above the ear, right in, barely into the hairline. And if they have a trigger point here, oftentimes they have bruxism or grinding with their teeth, and it feels like a little pea. And that can actually cause pain when you push on it. It can radiate into the temporalis region. So I like to, it's a very superficial injection. And this one, it's like a 10-degree angle. It's very similar to a TB injection. When you're doing a TB injection. So I'm going to turn you just a little bit. It's 10 degrees, bevel up, little pinch, barely under the skin, inject and out. That will bubble up, completely normal. And that will help treat the temporalis muscle. And next is the SCM, sternocleidomastoid muscle. The easiest way to palpate this is have the patient put their ear to their shoulder. So go ahead and ear to shoulder this way. And hers is very easy to visualize. You can actually grab it and feel it. Now that I know exactly where that SCM muscle, I'm going to bring her back to a neutral position and slightly open, and you can clearly see this SCM muscle. A general rule of thumb, especially if you're new to this and learning, 1/3 of the way up is a very safe zone. A lot of providers, if they're new, they tend to get a little bit nervous with the artery. It's pretty far down here. So as you're learning, the upper third is a very safe, easy zone. So I'm cleaning the skin. And this again is about a 10 to 20 degree angle, and I'm following the muscle. Here we go, a little pinch. And I'm going to do what's called like a windshield wiper, and I'm injecting. And this is going to help break up scar tissue. It may bubble up a little bit, that's okay. So those are the 3 main sites when you are treating jaw pain or TMJ pain. And finally, for the head neck region, the Splenius capitis is one we talked about. Go ahead and turn just a little bit. So her SCM is here, her paraspinal is here. Right in the middle is where the Splenius capitis is. So I'll put my thumb on it and I will rotate left and right. You physically can feel the Splenius capitis. I can feel it rotating underneath my thumb. And on this one, I don't go deep at all. You can see I'm at a 30 gauge half-inch needle. So I would clean it, I would go in at 90 degrees, bevel barely under the skin, and as I'm going in, I would do what's called a pepper technique. Inject about 1/4 to 1/2 cc. So those are the 3 to 4 main groups for head, neck, and jaw pain.